So thank you all for being here. As you well know, we've had our first case in Hamilton at the Juravinski Cancer Center, a Burlington resident that has been diagnosed with coronavirus. And so we are in a state of preparedness, have been for quite some time. I've Dr. Elizabeth, our medical officer of health here, and our Chief Sanderson, head of Paramedics, who can go over the level of preparedness, the case that we have in Hamilton, and the EOC activation that has occurred as a result of this case that will be ongoing. So I'm going to turn it over to Dr. Elizabeth to talk about the case in Hamilton, and then we can talk about the EOC and the additions. Doctor?
Thanks very much, Mr. Mayor. Thank you, everybody. I think as many of you heard earlier today, there was a press briefing in Halton to talk about the case that was diagnosed. This is a 32-year-old woman who is a resident of Burlington but does work in Hamilton, and so that's our tie. The person is a physician at the Juravinski Cancer Center, and there are a number of contacts that are related to the Juravinski that we're working to follow up. So real praise for this physician. They were very responsible. They had been away on a trip abroad and had come back and were self-monitoring in case they had any symptoms. As soon as they started to detect those symptoms while they were at work on Monday, they contacted an infectious disease physician. They made arrangements to safely be transferred to the emerge department and be tested, and immediately went home and were isolated at home. So there were some patients that the person was seeing that day. There were physicians and other workers that were working with them in that clinic. And so we are following up from a Hamilton perspective with any of those healthcare workers and with the patients who were involved in that clinic. I can tell you at this point that there are 34 contacts that we are following up. We're still figuring out who fits into which category related to those. We have taken a sort of three-level approach, so working first to look at those who had the most contact with this physician, so those who worked most directly with her and the patients that they saw. So those people are being asked to self-isolate. The remainder of the health workers who worked in the same area, we're also asking them to self-isolate as well. And finally, the patients that those other health workers saw that day, we are asking them to just be aware of the fact that they were involved and to self-monitor for any signs and symptoms. Because this is involving a cancer center and where there are people who are obviously more vulnerable in terms of their own health status, and where we would be concerned if they were to become infected with COVID, we're very vigilant, and that's why we've gone that extra degree of caution to notify those and ask them to self-monitor. So we're at about 30, as I said, we're at 34 contacts. We're continuing. The investigation is very much underway. Halton, as you've heard earlier today, is also working with family in terms of contact follow-up on their end as well. So it's very much a collaborative investigation between Hamilton Health Sciences, Hamilton Public Health, and Halton Public Health. You know, I think from the last few weeks that we have been working, we've had our IMS system, our incident management system, activated within public health services for the last several weeks. We have also been working at the health sector level, so that's with the hospitals, our colleagues in emergency medical services, our colleagues in primary care, our family physicians across the community to be coordinated and ready in terms of a response. We're working as well with the Ontario Health Agency and at the provincial level in terms of a coordinated response as we move forward. Here, as in Hamilton, we were getting to the point where we said we wanted to expand that level of support as well, and so we have activated the Emergency Operations Center in order to support the response and to ensure continuity of operations should there continue to be more cases of this disease and impacts in terms of people being ill, and to support the response that's going on in the health sector. So just one thing to remember at this point in time, we have not seen community spread here in Hamilton. That is the hallmark of what we're looking for in terms of progression with this. We are concerned that this will continue to evolve, so we want to make sure that people are prepared, that they are thinking about the spread of infection, that they're taking those same measures that we really ask them to every day. So to stay home if you're sick, if you're working with someone or have somebody who's ill, to maintain a distance from them, to wash your hands frequently and often, make sure you're getting all the vaccines that you should get, make sure you're taking care of yourself and staying as well as you can. We are, of course, particularly concerned about those who are most vulnerable, and we're wanting to make sure that they are best protected. We do have a website, which is www.hamilton.ca/coronavirus, which is up and operating. We do also have a hotline that you can find the number for, or you can just dial 905-546-2424, our contact center, and ask to speak to the hotline staff. And we are taking questions from across the public, people who are symptomatic that just have questions. Of course, we're encouraging anybody who's ill to contact their health provider in advance before going there so that appropriate precautions can be taken. At this point, I'm going to turn it over to the chief to talk further about paramedics and what they're doing to prepare and respond in this situation, and perhaps tell us a little bit more about the EOC.
Thank you, Mr. Mayor. Thank you, Dr. Richardson, and thank you for being here. From the paramedic perspective, we've been working provincially with all of our partners, the Ministry of Health, with the Provincial Association, the Emergency Operations Center, and we've been preparing for some time period in terms of how we manage this. Our preparation goes back as early as the end of December, early January, as the issues are coming forward. So we are prepared. We have all of our staff trained in the activities. We have the required personal protective equipment. We've actually had responses for patients who were suspected to be COVID, or at the time coronavirus patients, and we've managed those quite effectively. We've integrated with the hospitals in terms of patient transport. We're very confident in terms of our skills and our abilities to be able to do that, just as all ambulance services across the province are doing that on a normal basis. So there's really nothing unusual to report on that, other than to say, as a good Boy Scout would always want to be, we want to be prepared. We want to make sure that we have the stuff available for our paramedics. We want to make sure our people are protected and the public are protected. With respect to the activation of the Emergency Operations Center, as Dr. Richardson identified, one of the things that we expect the public to do in the process is to plan and to be prepared. And that's really the reason for activation of an Emergency Operations Center. That provides us access to an additional number of resources across the city. We can dedicate and focus resources on it. As we look at it right now, we have a minimal activation level within the EOC. That is having an operations level, having a logistics level, having a planning level, and having a finance level. And those are standard IMS structures in terms of how we would move forward. We had a very preliminary meeting to make a decision this morning to activate the Emergency Operations Center to respond and to prepare for the future, as well as some of the needs that we have at present as staff are being stretched in capacity. We will be meeting on a daily basis starting tomorrow, either in person at a low-level activation or through different video means and other contacts, so virtual EOC operations. Certainly as things move forward, as they develop, we may have to ramp up that level, but that's a decision we would make based upon the needs and the activities. Our Emergency Operations Center is separate from the Emergency Health and the Hospital's Operations Center, but we're certainly going to be integrated and continuing to work with them in the process and the activities. So thank you for that.
Okay, thank you. So we want to kind of impart to the community that the public health and paramedics and the healthcare system is prepared and working actively to deal with any cases that occur. And of course, today's the first of in Hamilton. We may anticipate more, and we'll certainly be able to manage that and deal with that as we go forward. And so, and if there's new additional information to be shared, we'll be doing that on a regular basis as much as possible to keep the community and public council and all of you informed as to what's occurring in the community and what kind of steps are being taken to rectify or remediate those issues. So if you have any questions, now would be a good time to fire them.
Dr. Richardson, what do we know in terms of the spouse who works at St. Joe's? What do we know in terms of, did that person do any surgeries? How many people did they come into contact with?
Thanks, Sam. So that person actually is a resident of Halton, so Halton is following up on those pieces of information. If there's action that we need to take that relates to anything to do with Hamilton, we will be doing that. At this point, our understanding has been that this person is not symptomatic, so they are not a case, and so there wouldn't be further follow-up of contacts at this time, but Halton is undertaking that and will have the most up-to-date information.
Dr. Richardson, sorry, do you know if that person is self-isolating at least?
We do understand that this contact was notified during the night and is self-isolating.
I wanted to ask Chief Sanderson, what are paramedics doing? Paramedics are going to be on the front line of people who have symptoms. How are paramedics protecting themselves?
It's a great question. Paramedics are protecting themselves very much as we have with every exotic contagious disease. We've gone through it with H1N1, we've gone through it with MERS, we went through it previously with SARS, and we've gone through it most recently with Ebola. We have the protective equipment in place in every ambulance. All of our paramedics are trained in the activities, whether it be donning and doffing of protective equipment. They're all fit tested with the appropriate mask. If anything, we're taking extra precautions in the activity because our paramedics work in the back of the ambulance in very close proximity. Screening is happening at the dispatch center level. Callers to the dispatch center when they're exhibiting signs of febrile respiratory or enteric infection. They are being screened in the activity. Questions are being asked about travel. And if they're screening positive on that, paramedics take immediate action on arrival at the scene. If they haven't screened positive at the dispatch level, paramedics take a second level of precaution in doing their own screening on arrival at the scene. If a patient screens positive in the activity, protective equipment is donned, extra crews are brought in to help assist on the process, hospitals are notified prior to transport, and the patients are transported to hospital. And I can tell you we've already had a couple of suspect cases that have been dealt with that way in the city of Hamilton. They've all turned out to be negative in terms of actual coronavirus or the COVID-19. However, we still take the same precautions, and if anything, it's an over-precaution in terms of our paramedic response, and that's the right thing to do for our paramedics and for the patients.
If people want to be tested, should people be tested? Or how would they get tested?
So at this point, in terms of testing for COVID-19, that is done if somebody has symptoms, and so it's up to the healthcare providers to make that decision about whether to test them or not. So it is particularly people who have symptoms, who may have traveled, have a contact with a case, something like that, that we would encourage them to either call us and we can talk with them about their symptoms and maybe give them some advice, or to call their healthcare provider if they're concerned, and then the decision about testing would ultimately be made by a healthcare professional in consultation with that patient.
What's your name
in terms of large gatherings of people?
Absolutely. So that's one of the measures that we look at. We call them public health measures that are looking to create social distancing, the sort of terms we use, and looking to create that distance so infection is much harder to spread. So the Public Health Agency of Canada yesterday came out with some guidance on that. At this point, we're not at the point of saying all mass gatherings should be canceled or anything of that sort, but we are definitely encouraging organizers or people who are planning to attend those kinds of events to look at that document that is on the Public Health Agency of Canada website and think about some factors like, what's your own level of risk in terms of going to such a gathering? So are you elderly? Do you have multiple chronic conditions? What's the gathering of? Is it a group of people who've traveled from abroad who are coming from areas where they have high numbers of cases? Maybe you wouldn't want to go to those, or maybe that should be canceled. Is it a kind of setting where everybody's just coming and doing their own thing and it's somehow connected in a video or way, or is it something where everybody's closely together and doing things together? So it's looking at all of those sorts of factors and then making a decision. Ultimately, the decision around mass gatherings that will get made, that we are in consultation across the province and with the Public Health Agency about when would we go to more specific advice about that kind of thing.
So the around the bay boat race is safe so far?
As far as I know, and I think, again, it'll be a judgment call on behalf of the organizers, but I think there's no indicator at this point that anything like that should stop, unless there are folks that are particularly prone to contracting disease and being affected by it, and that generally tends to be the elderly with already noted preconditions that are at most risk. If you're healthy and young and vibrant and active, I think you should get on with your life.
Dr. Richardson, I want to ask, at this stage, have all 14 of those patients been contacted, and are they all necessarily local? They were here, but and maybe they live elsewhere.
So there's actually a total of 34 contacts at this point that we are following up on. So we understand the hospital has contacted all 34 of those. We're still understanding where they fit in each of the groupings now that we have received them, and we are following up with them as we speak. Our staff are calling them, trying to understand exactly where they sit in that order and whether they should be in isolation or in self-monitoring. But they've had one level of contact already for all of them, and we're following up with them beyond that.
So everyone has been contacted, all 34, all those 34 are patients, is that correct?
So that's our total number of contacts, and so you heard earlier today in terms of the number of physicians, healthcare workers who were at the site. And so we're just trying to make sure we've got our numbers straight, and we're still in that process of that total number of 34. Remembering that there were patients, there were healthcare workers who were from the site, and there would be people who traveled with those patients to accompany them, as you might expect, on their visit to the cancer center. So it's all of those groups. That's our understanding at this point, but we are going through again and continuing the investigation.
No, the 14 patients that I mentioned earlier today that I think had direct contact or maybe with the doctor that has the virus, had they been contacted? That's what I wanted to establish.
So our understanding is that all of the contacts that were at the center have been identified. That's the 34. They fit into those three groups I've been talking about, the people who had the highest level of contact with the case, the next highest level, and then that third contacts of contacts really level. And so that is numbering 34, and then exactly how many are at each, I don't have that yet, have you?
Dr. Richardson, does the city have a pandemic plan, and how can we get our hands on it?
So the city did have a pandemic plan that was created about 2007. The approach, though, in emergency management has shifted in terms of creating specific plans that address specific perils, as we call them, to one that addresses sort of all sorts of different levels of risk. So we have used more of an approach to communicable disease outbreaks and those sorts of things, and those are the kinds of plans that we've been creating. It's an important point too, Sam, even just in talking about this particular illness, that really what we're talking about is people need to be thinking about what they're going to do after this is done. We talked in SARS about how we had a new normal around infection control and those sorts of things. And so thinking, this really gives us an opportunity to think again about the things that we are doing, the precautions we are taking to stop the spread of respiratory infections. If we're doing it for this, we should be doing similar things in terms of flu when it comes to hand washing, vaccination, all of those things that are important to keep ourselves healthy.
Have you made plans for it? I'm sorry. I didn't know if you were going to. Do you have plans for a mass testing site, if need be?
The issue of assessment centers is one that we do look at in terms of how we would respond to these sorts of situations. You might remember in H1N1, we did set up assessment centers here in Hamilton with Hamilton Health Sciences and St. Joseph's Hospital and our primary care physicians, again, collaborating. And we have been talking and planning about that here. We're doing that in conjunction with the Ontario Health Agency, specifically the West Region that we're working with, and looking at what would be the triggers, when might we open such centers.
The federal government announced some funding for the provinces. Have you heard anything that Hamilton would receive any type of funding for this issue?
Not heard anything directly. I did note that the Prime Minister indicated $1 billion to help offset the impacts. Some of it actually going directly into research, possibly some of it going back to businesses or individuals that have to isolate themselves and are potentially losing a paycheck, I believe. So the resources are being put there. How that's going to break out and where that's going to go to is yet to be determined. But I think they did say $275 million was going directly into research to look for, I would think, remedies. So that's a positive initiative. And I think that both the province and the federal government need to look at as this, if and when this ramps up to a higher degree, what kind of community impacts are going to take place, what kind of negative impacts are there going to be on businesses and on individuals, and how can we help offset that. So I think that they're probably already thinking about it. I think the $1 billion is part of that, but I suspect if it becomes a bigger issue, then more resources are going to be required.
So do you think that Hamilton will continue to have more cases of COVID-19?
So it is an ongoing, evolving situation. We have continued to see spread across the globe in terms of this and continue to see cases in Canada. So we are concerned that we may continue to see cases here. You know, as we go through this particular event, what we're looking to do is to work together to slow any spread, to encourage community members. Again, that piece about trying to avoid infections and take protective measures is very important to slow that down. We want to prevent the overall number of people in getting sick, and we particularly want to prevent those who are most vulnerable from getting sick, those who are most likely to get severely sick and perhaps even die. We're trying to do that both to decrease the overall numbers and to slow it down so that, as you heard the Mayor talk about, they're looking to do research to look for treatments, vaccines that might be able to work, and so as to give time for that as well.
Dr. Richardson, could you talk a little bit about supply levels, like from masks and disinfectants? Is that going to be an issue? Is there concern about that?
So I'll just make a couple of comments and then turn it over to the chief because he has, of course, day-to-day challenges around this. Supplies are something that is on everybody's mind when it comes to this issue. All of our health partners, that is their number one concern, is making sure they have the supplies so that they can ensure their workers are protected and ensure that anybody who comes in who is ill is protected and not spreading the infection. So we know the province is working on that. They have logistics groups set up. We know that the federal level has logistics groups set up. And I might turn it over to the chief to talk, for example, about what they're doing here with paramedics.
Thank you. So when we started into the process in January, as we're going through the fit testing, an annual fit testing process for all of our staff, we checked all of our supplies. We looked at our levels, in particular the N95 particulator mask supplies or respirator mask supplies. Those are the ones that our paramedics are using currently, which protects against airborne droplet and contact process. And really it's about the droplet and the contact. It's actually a bit of an overkill in terms of the activities, but we prefer that in terms of close contact in the back of the ambulance, and that matches off to ministry standards. The discussions with my logistics team right now, we have at least a 30-day supply of them on hand. That's more than many ambulance services have in terms of their activity. We're continuing to work with the province and work with our vendors in terms of accessing additional supplies. We do know that there is a major stockpile held by the province, and there are probably some held nationally, and we're continuing to work with the province on those issues. However, I'm not concerned about the level of supplies right now. We do have a backup plan in terms of North 7700 masks as an alternative to the N95 masks, and those North 7700 masks work with a disc rather than having just a single thing, and they're not a disposable mask. So we do have some level of continuity for that, and that's a backup plan for our paramedics.
I just wanted to, where is the emergency center?
The Emergency Operations Center is located on the first floor of the Multi-Agency Training Center on Stone Church Road. It is a secure access facility, so it's not something that's open to everybody in the process, but that's where it's physically located. When the EOC is activated, all the participants either attend there or they attend virtually.
I just have one more question. I'm just thinking in terms of organizations like Good Shepherd, YWCA, shelters, people who, are living rough, or how are you reaching out to those people?
So there's sort of two arms to what I would call the sort of emergency social services arm of or issues related to this outbreak. So one is for people who are being asked to self-isolate, how to support them if they don't happen to have somebody who can help them to get food and those sorts of things. So we do have some people who are working together across the social services within Hamilton to ensure those people do have food, do have the things they need in order to survive through their isolation process. We are continuing to talk with groups like Good Shepherd, with others, about how would we move forward through this situation, and that's part of what we'll be working on together with the EOC in those for those sorts of situations.
Dr. Richardson, sorry, I'm a little confused about why we're not concerned about the airplane that came from Hawaii and,
Sure.
and the surgeon who works at St. Joe's. Is it that you're not contagious before you're symptomatic, or why are those concerns so huge?
So it's absolutely true that we're still coming to understand this disease, but we get more and more information, and it's being worked on by scientists across the globe in terms of what this disease is really about. So from what we understand, what we call the incubation period, so the time from when you're exposed till you get sick is somewhere between 2 and 14 days. It's usually about 5 or 6 days. And so if there's a time before you are symptomatic, we're not really concerned about transmission. We do, out of precautions, go back a little bit before they become symptomatic, just to make sure we've caught anybody in doing contact management. But it really seems to be people who are in closer contact and when they're more symptomatic who are more likely to get infected. So for the particular individuals involved, they were not symptomatic at all during their flight, and indeed it predated by a couple of days their actual becoming symptomatic, and so we're not concerned about those kinds of exposures.
Okay, and in terms of, mention other cases, it would surprise me if we didn't have more cases. We're not looking for them, but I think realistically we can anticipate that there likely will be more. Hopefully the level of response will be appropriate. As we indicated today, everyone's ready, and how we manage that will minimize the impacts going forward. And that's really the lesson for today, is that there's a level of preparedness here that is ready to respond quickly and effectively and collaboratively with all the agencies. And as we anticipate possibly more cases, we're ready to deal with them. Thank you all very much.